So I'm going to start recording now, and we'll see what we can see. Okay, so let me turn on my share. It's recording now. Recording it now, in fact. I might have to make some changes to how I do things in future. I'll just make a couple of comments. Yeah, the main reason I quit the Prepare IELTS group was it was a complete waste of time. Nobody was saying anything. The previous admins, Joseph, Samir, etc. Nobody was posting anything. Nobody was doing anything. Maybe because I said I'm not doing free stuff anymore. That's why people weren't interested. I'm not really sure why. But we had over 4,000 people in the group and nothing was happening. Absolutely nothing. Complete waste of time. So we'll see how it goes. So the new group, which you should be in, is only for subscribers to Patreon. However, we'll see about this too, because you know, for $1 a month, and it's the same people sending me letters. So there's a couple of people are having 2 or 3 letters assessed, and they've essentially paid me $1, which is not good economics, really. Not for me in any case. You know, my usual fee is 12, or like for 40 euros, and all I'm getting is $1, and people are sending me 2 or 3 letters for assessment. So that is going to have to change this coming week, because I can't afford that. I don't have time. So let's get on with this. I'm writing to refer you, Mrs. Potter. You mean I'm writing to refer Mrs. Potter to you? I think that's better. Let me put some changes on. Oops, don't want a password. Hang on. Changes. Okay, I'm writing to refer Mrs. Potter, whose signs and symptoms are suggestive of the arthritis in the left knee. Put a comma there, and that's now a non-defining relative clause. For your surgical consultation and possibility of knee replacement operation. That's good. Regarding her medical history, Mrs. Potter has had osteoarthritis since 2008. Well-controlled hypertension, intermittent urinary infection, and the last in the list, put a comma, insomnia. Her medications are, etc., etc. On the 23rd, Mrs. Potter presented with a complaint of a sharp pain in her left knee during walking, which has also been, which persisted at rest. In addition, now, one thing I noticed here, but we've got a mixture of pronouns. You've got she, he, his, her. You would certainly be losing marks for this. She felt a mild pain, you see, his, in her right knee only while moving. Well, while moving. It should be mentioned that her left knee pain started last year and has become more intense. Okay, and on examination there was tenderness in the left knee, therefore I also prescribed a naproxen. Okay. So the main thing here is we've got what? She, her, his, he, she. The examiner wouldn't be very pleased with all the confusion in pronouns here. Today, now, X-ray of Mrs. Potter. You can't have an X-ray possessive. So today, Mrs. Potter's X-ray or her X-ray revealed. So need to move this. It should be capitalized. and genitive. Today, Mrs. Potter's x-ray revealed an acute osteoarthritis with presence of osteophytes and diminished left knee joint space. Therefore, I increased analgesic dosage and referred her for physiotherapy sessions. In view of the above, I would appreciate your assessment and treatment of Mrs. Potter. And please don't hesitate to contact me if there is further queries, if there are any further queries. Okay, so main thing here, watch those pronouns. Her, his, she, he. No, you don't want to be losing marks over something as obvious as that. Okay. As I've said before, did you do it there? No, right. You don't need a period after Mr., Mrs., or Ms. Writing to refer Mrs. Weishman, 84, right. Widowed what? Widowed, so that's an adjective. So what you want is to make it a widow. Okay. Whose features are consistent with early stages of Alzheimer's disease. Your further management will be highly appreciated. What do I keep saying about this? Right. I posted a couple of videos in the previous group. I don't know, was it the previous group or the new one of Rebecca? What did she say about being concise and clear? So I don't know if you saw those. There was a couple of videos that she made last week, which I posted. She, as you said, the new criteria of purpose, be concise and clear. So what you want, I believe I remember this correctly from the case notes, you want so you have made a tentative provisional diagnosis and you want this diagnosis confirmed. That's what I remember from a note. So that should be here. Not your further management will be highly appreciated. So go back to the group, watch Rebecca's videos where she explicitly says, clear, concise. What is it that you want the reader to know and do, right? She doesn't use this phrase. What she says is, get to the point. This is why they've got this new criteria of purpose. She explains it there. It's to do with, the busy healthcare professionals don't have time to piss about, right? They want to know, why am I reading this? What is it that you want? So it's got to be clear right from the start. I want you to confirm my provisional diagnosis, etc. Not your further management will be highly appreciated. Should I add it to the end of my letter? Well, no. Have you ever seen this in any official OET? So if we download the official OET letters, the samples, which they altered in April to reflect the criteria changes, we will not find this sentence. If we go to E2 or swoosh, we will not find this. Why? Because it's meaningless. It's not concise. So try to avoid it. Regarding a past medical history, respectively, worth mentioning, which is family history, were prescribed. Well, we usually use the simple past when we know when the past event occurred. It's supposed to be, so we've got two different things, have been, because we don't know when, so we have to use present perfect indefinite time. Worth mentioning that she's a family history disease. She measures alone, although she has children. So including this sentence, what's its purpose? Unless you're going to draw some conclusion or use this to make some point or to reinforce a point, it's kind of, why am I reading it? Okay. She had attended my clinic for several occasions. You mean on several occasions. So I would put her name, right? So this is, how do you spell it? Mrs. Leishman had. Well, why is it had? Why is it past perfect? Shouldn't it be present perfect? Has attended my clinic on several occasions since 2007. However, okay, and we need to know this, what, she just came for what? So it's again, if you're adding stuff, right, let me get that criteria out. Let me get it out. Let's have a look at it. Where did I put it? Criteria. Let's get this out and have a look at it. Right. Get me pen. So, right. So the purpose, key information included. So these are two sides of the same coin, as I say. Well, as we say, what you include, what you exclude. Okay. So key information included. Okay. No irrelevant information included. So don't add stuff unless you're going to use it. What would be the actual point of it? Oh, hang on. You probably can't see that. And I'll have to share it again. Okay, right. So this is the criteria. Yeah. Yeah, this is the criteria. So the purpose, okay, immediately apparent. I want you to do X, Y, Z, and the reason I want you to do it is because blah, 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 throughout the rest of the document, okay? So the content, so as I said, these are two sides of the same coin, what to include, what to exclude. Key information, okay, no irrelevant information. So you've got to be careful. So don't include any sentences if you're not going to use them in some way, instead of just saying, oh, blah, 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 So on several occasions, 2007, she was found to be increased in the blood pressure. How was she found to be increased in the blood? So, she was found to, her blood pressure has, this is very awkward. She was found to be increased in the blood pressure. She was found, why is it passive? Found by whom? So, however, she presented with increased blood pressure. Oops, my typing. Blood pressure at 14589 as well. Okay, that's better. As well as with my typing tonight, as well as with slightly increased LDA level, reduced D level, and that visits both. Right. Now, this is one sentence. I've just noticed this now. This is what you call a run-on sentence. So she presented with increased as well as slightly increased and reduced, and that it's perfect without demonstrating that she had not done unless she was advised to use Webster Pack. Too long sentence. It's too long. Hang on a second. Let me get the chat. What did Wes? Hang on. Somebody saying, okay, should be presented with an increase blood pressure. Well, an increase in or increased, as I've done here. Or she presented with high blood pressure or something such as that, yeah? But main thing here, that's too long. as a single sentence. Yeah, run-on sentence. So, however, she presented with Greece as well as slightly created, and that bit especially with no demonstration that she hadn't said. But she was too long. Break it down. Break it into two. Okay, break it into two. On today's visit, we don't need that. Mrs. Welshman attended my clinic with my daughter, who was worried about her mother's. Okay, that's good. The patient's daughter noted that Mrs. Welshman was getting dinner engagement. So, well, you don't need to mention dinner engagements as such. You should just, she was forgetting social events or social activities. We don't really need to say dinner engagement, because that's basically the same as social events, isn't it? So just say, well, she noted, she didn't note, she reported to you. She didn't actually note, she reported it or mentioned or stated, Mrs. Welshman was getting dinner sense social events. What about the patient? Patient, shouldn't that be a genitive case? Patient's behavioral changes. Some spelling, I don't know. We have to have a U there. As well as decision-making issues on the assessment. She was several attempts. Okay, now you've got to watch it here, because this is what we call a dangling participle. We're not clear who. Now, from the context we can guess, but from the grammatical sense of the sentence, it's not clear who was being assessed, because she was worried, and then on her memory assessment. So you need to be careful there. But she's for assessment confirmed. So yeah, this is what you want the reader to do. So now this is what, so again, watch Rebecca's videos. So what she said was, healthcare people don't want to have to read all the way down. Oh, this is what you want me to do. That's what she said. That's not what they want. They want to know right from the start, diagnosis needs confirmation. Okay, so just be careful with that purpose there. Right, Ray, let's see what we've got here. To update you and review Mr. Garcia and the hospital who was admitted to hospital and being discharged today. Okay, so I'm writing to update you. Okay, so it's clear from the opening sentence what it is that you want the reader to do, or what the purpose is. I'm writing to update you. I've got some information I want to tell you about this person. Okay. On today's admission, Ms. Garcia presented with a complaint of having painful and rigid joints lasting 12 weeks, which had lasted. That past perfect, because you've got the simple past and then past perfect, which had lasted for the previous week. She noted having light sensitivity, new bruising, lesions of skin, headaches, different skin on examination. Okay, yeah, that's good. On review, Ms. Garcia's test results, her white cell count, okay, definite diagnosis were prescribed. Discussion. Right. No, okay, so that's good. Following her proper treatment response, I discussed with Miss Garcia's family the necessity of having immunization and notification. So that's better. I discussed with Miss Garcia's family the necessity of having immunization, and I planned to notify the Department of Human Services. Okay, that's better, because that's slightly awkward using that passive. Now, you're supposed to use passive, you know, passive needs to be used when appropriate, as with all the conventions and structures, when appropriate. Now, that sentence works better in active, I think, because it's slightly clumsy in passive. But okay. According to Ms. Garcia's discharge powers, I should be observing symptoms and okay, not too bad, not too bad. Okay. Urgent assessment for, urgent assessment of. Clark, we don't need that. Who requests for evaluation management of unstable or her unstable angina. Somebody because she doesn't smoke, she's a social drinker. Well, why do you tell me what she doesn't do? You know, it's like, oh, she doesn't have AIDS. Oh, okay, thanks for telling me that. Oh, she doesn't inject herself with narcotics. Well, why are you tell me what she doesn't do? Tell me what she does do. Okay. Social drinker, medical conditions, what she takes. Okay, that's good. History of pushing pain and exertion, which was associated with this man, and lasted, because it's in the past. Pain, the pain has radiated. Why is it present perfect? Right down to the left arm, and was relieved by rest. Now, let me just check this, because this looks a little bit short. 165, I thought so. Too short. I mean, just having a look at it, it does look a little bit brief. Okay, so the only thing is, though, if it's too short, you're probably going to be missing out vital information if it's too short. So, okay. There's actually attack. I had a history of my college. At the age of 59. Short sentence. What's that doing there? Her examination was unremarkable. Yes, but she doesn't smoke. It's a risk factor, but she doesn't do it. So why mention, oh, she doesn't inject drugs and she doesn't smoke and she doesn't have sex? Why say something that she doesn't do? It's a risk factor. If she did it, then yeah, I would use it. She is a smoker and a drinker, but she's not. So that's, this is why I'm asking, why tell me something that she does not do? Okay. Examination was unremarkable. This sentence is connected. How, where, what, why. That doesn't really work. Unconnected sentence. So that's not bad, but too short. 165 words, needs a bit of extension there. Mrs. Bowen, okay, don't need that. I wanted to request your assessment. Right, your assessment. I'm writing to request your assessment of management of Mrs. Bowen. That's is good. You see, I know what you want me to do now. Okay, good. I don't have to wait right down to the end and assessment management, Mrs. Bowen. Presented with a feature suggested polycystic ovary syndrome. Mrs. Bowen didn't make clinical occasions. That's supposed to be part of the sentence. I prescribed her the pills. Okay. That's, nothing to complain about there. That's pretty good English. Huh? Okay. On today's visit, I'm having difficulty conceiving despite this associate. What is this? What does this refer to? Despite the right. So I probably put a comma there. So Miss Bowen presented complaining of difficulty in conceiving, despite this discontinuation of the OCP. which was, or this difficulty was associated with amenorrhea, depression, and weight gain. Upon examine, she was obese. Is she not obese now? She's not going to lose weight in the matter of a few hours. She is currently obese. We're both in 28, and there was, well, is, because that's not changed, cosmetic treated hirsutism. Consequently, I requested a blood test, which elevation of 300. They ordered from a ultrasound in view of the above, don't need mentioned. Okay, I should request that in the chronology reviewed. If no person contact me. Okay, yeah, not too bad. Not too bad. Who's this? Ahmed. Okay, I'm writing to refer Miss Kaze. Miss, isn't it Mrs. if she is married? Usually, there's no reconstructive surgery due to present. You mean the presence of? Due to, okay, due to the presence of invasive ductal carcinoma in her left breast. Okay, Mrs. Kaze should be capitalized. Married with 3 children. She's overweight with a BMI. To make it proper sentences. Okay. She went to a lumpectomy 5 years ago for a benign tumor. Don't forget your articles in her right breast. Clinic actually discovered an almond painless lump in the left breast, and size, and then they put assessed. This is better. This was not increasing in size, and there was no nipple. No, yeah, we'll make it part of previous sentence, which was not increasing in size. Okay, and no nipple discharge. 2 centimeters, harm of the margin. Investigation advised her to review. Advised her to come back for a review, not to review. She's not going to review herself. Advised her to return for review in 2 weeks. Mrs. Kaze visited me again. She was anxious, and the BP is 150 of 90. Consequently, that's a short sentence, isn't it? Consequently, diazepam was prescribed. Unfortunately, the US, is that supposed to be ultrasound? Well, you can write it out. 16 watts, is that inches, centimeters? That size with variable echogenicity, suspicious. High suspicious, make it an adverb, highly suspicious, malignant area. Therefore, I requested a core biopsy for her. Mrs. Kaze asked me for the sister. Sister underwent an operation with your team. As a sister underwent an operation with your team. But you need to say when, or use some perfect form. As a sister had previously, that's better, undergone an operation with your team. Okay, good. Make that past perfect. So referred, simple past, past perfect. That's good. Okay, not too bad, not too bad. Sophia. Right, I don't have a lot of time, so I might not get through all of these. I'm waiting to request, hang on, just check the, now this isn't complete because it doesn't have the address or the date or dear doctor, blah, 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 etc. So this is not quite complete. The follow-up investigation assessment, Mrs. Clark. We don't need that verb. Suggestive of bronchogenic carcinoma. Smoking that since then for the years. Okay. Right, she attended this and I had prescribed. Right. Why would you use past perfect? Because the simple past, because we know Mrs. Clark attended and I prescribed her, etc., to combat her illness. Well, why else would you prescribe it? For a laugh and a joke? So we don't really need this, do we? To combat her illness, to make her better, to fix her, you know? It's obvious why you prescribed it. So you could probably say, for which I prescribed augmentin. Okay, that's better. On today's Clark, Mrs. presented to me as opposed to presenting to some random stranger in the street. Presented, suffering from a dry, non-productive cough, suffering from a dry, productive cough, which had lasted 7 weeks. Mild dyspnea, heaviness in the chest, she not experiencing any signs of fever, night swelling or rigors, emission revealed consultation in the lungs. I requested an x-ray. Well, we don't really need present perfect because we don't, you know, you did it today, so we don't really need it. Because we know from the context when the past action occurred. Today. I requested an x-ray together with a CT scan or with a CT scan. You should put an article. For the chest, which is the oil management of the hill. Mrs. Clark, mechanic carcinoma is having. Why is that perfect form? Wouldn't it be simply has? Investigate with a bronchoscopy and biopsy. Okay. Okay, not too bad, not too bad. Just watch your verb forms. Well, an augmentin, I don't know if an augmentin, if you mean it's a single one, if it's a single dose, a single pill. I don't think it makes a lot of difference there, you know, in terms of articles. Don't think it matters. Okay, right, I've just got 5 minutes. Got to get these two right. Okay. I took a question over to Mrs. Jane Smith, who's recovering off medical infection, stepping from his kit and support. Okay, that's clear. Examination revealed. An examination, further examination. Infection of hearts, lateral heart wall. For which an urgent angioplasty was conducted. Okay, make that. For which an angioplasty was conducted. That's better. During hospitalization, she's been observed closely and provided bedside care along with showering assistance, a combination of prescribed. Beside that, she was educated regarding diet and light exercise. Okay. Initially, Mrs. Smith had her chest pain on 2nd 6/19. Right, yeah, I think I mentioned, yeah, other songs, right. This looks like the one that you sent me before. I think I've seen this before. I think I saw it last time, but I didn't make a video. Yeah, it's the same. What I was going to say, right, what I said then, what I'll say now, the order of the paragraphs. Now, I'm not sure. Community nurse and Madam Smith. Okay. So you've got, okay, she came to the hospital, and okay, then we're going back in time about a chest pain. which happened 2 weeks before. Okay, she's a widow and there was a son. She had a fall, a appraisement house. So in terms of organization, I would have made this a chronology. As in, you know, I would have put this here, and then put this here, and then in view of the above, can you provide health, education, and visit her, etc. Because I mean, right, you only put the urgent thing first when you want them to take urgent action. Like if a patient comes in and looks like he's going to have a heart attack on the spot, then you put that first. But all this is in the past. So home visits, she's being discharged to a day. So she had this chest pain and this happened and that happened. Then she came into hospital. So as a matter of fact, I would be tempted, I would probably put that for paragraph 2, then that for paragraph 3, and that for paragraph 4. And then in view of the above, I would appreciate you to do this. Okay? I think the logic would work a little better there. 2 minutes left, less than 2 minutes. Oh, okay. Miss Maybell, oh yeah. This is not bad. I looked at it earlier. Applied on the foot also. You should say one thing first. Okay. As a matter of fact, and this is one of my students in person, so I know this. This letter is pretty good. I looked at it when she sent it to me yesterday or the day before. It's not bad at all. Yeah, there's nothing for me to actually change there because that's pretty good in terms of. But I say I have had several one-to-one sessions with Lucia, so I don't really need to make any comments there. So if you watch this video later, this letter is pretty good. And I'll no doubt speak to you about it next week. Right, this is going to turn off in less than a minute. So what I'm going to do, I'm going to stop it here and I'll be in Telegram for a while because this is going to turn off in less than a minute. So I'll see you there if you've got any questions.